The MAP study, or Mental Health Admissions to Paediatric Ward study, is an NIHR-funded study. It's based at University College London. And we've noticed and heard that more and more children were being admitted to general children's wards because of acute mental health crises. There's very little literature on this, and we know that people want to make this better for staff and better for children, young people and their families. So we've had a project that's been running for the last 2 years. It's made up of 3 work packages. The first work package, where we've actually produced a paper in the Lancet recently, Lancet Child Adolescent Health, which is looking at overall numbers and trends of those admissions in England. And what we found between 2012 and 2022 was that there was a 65% increase in admissions to general children's wards because of a mental health crisis, and in particular the 11 to 15-year-old girls and eating disorders, where there's been around a 500% increase in those admissions. We also know that admissions are getting longer, so the number of admissions lasting more than 2 weeks or longer. Work Package 2 has been collaborative work with 15 other hospitals in England, where we've been doing a surveillance study to get actual granular data on children and young people who are admitted to wards, so we know who's been sectioned, how long they're in for, and what the problems they've encountered. And Work Package 3 is a qualitative piece of work where we are interviewing children, young people and staff to understand what needs to be done better about these wards admissions, what's not so good about those admissions, and we're pulling all that together with a big stakeholder group, Royal College of Paediatrics and Child Health, Royal College of Psychiatrists, and young people and parents to come up with a recommendation for anyone internationally and in the UK about what we need to do better about this. The key thing with this is that there's very little literature on this at all, and these children, young people and the staff looking after them deserve better. It's here to stay. We all need to get better at it, and I think our data is delivering to show that we need to work harder at it and get better at it.